Exploring Japan's Healthcare by Hannah Colson, Quinten Travis, and Zachary Tarter. When looking at an overview of Japan's healthcare, it is relatively comparable, however slightly favored to healthcare in the United States. Japan ranks number 10 in the world for quality of healthcare, whereas the United States ranks number 37. Japan also has some of the highest ranked doctors in the world and also has the highest life expectancy for its citizens. When looking into Japan's health insurance, Japan requires by law that all citizens indeed do have health insurance. Japan has a public national health insurance option that is available to its citizens, as well as a community insurance option. Most Japanese citizens, however, receive health care coverage through their employers. Insurance companies, then, are not permitted to make any profits off of these people. All citizens are covered and have access to any specialist that they desire. Therefore, they have access to any professional or doctor that they wish to see. Lastly, all procedures have a set and fixed price across the country that the government sets at the beginning of the year. This means that whatever procedure or whatever tool that needs to be done for your health care is the same price no matter where you go or whatever time of the year you need the procedure done. We will now hear from a native Japanese citizen, Kenji Takata, about his opinion on healthcare and health insurance coverage in Japan.
Okay, so what's your kind of opinion about the healthcare system in Japan? Do you think it could be improved? If so, how could it be improved? Or what do you like about it? What do you like about the healthcare system in Japan? Or don't like?
Yeah, so I like the health insurance system in Japan because when I was a child, I had a lot of sickness, and then I got injured a lot of times because I was a member of a basketball club, and then
Member of what?
Basketball club.
Basketball.
Yeah, I was playing basketball, and then so there's a lot of times I went to the joint, I don't know, to fix the joint or and then if I took the food, it's free before the junior high school, so we can feel free to go hospital when I have a problem. So it's so good, and then I don't think the health system, insurance system, is improving because there's a lot of older people. The number of the older people is getting increased, so there's no room for cover these kinds of people. So I don't think it's improving, but it's stay the standard level.
Professional training is handled slightly different in Japan than in the United States. There are 79 different medical schools in Japan. This means that there is one per 1.6 million people in this country. Medical school is 6 years long and begins right after high school. The curriculum for medical school includes 4 years of preclinical education, then followed by 2 years of clinical education. Students must complete at least 2 years of postgraduate training after medical school. And lastly, students' work hours are limited to only 40 hours per week. There are many cultural influences that affect healthcare in Japan. The concept of shame is linked to all aspects of Japanese life, including health. There is a lot of importance that is placed on achieving success and maintaining a good health status while in Japan. Poor health, therefore, can be a target of ridicule in Japanese culture, therefore promoting an overall healthier lifestyle. Lastly, factors such as obesity and other health issues are much less culturally accepted in this country than in the United States. Lastly, while there are many great aspects of Japanese healthcare, there are also some drawbacks. 50% of Japanese hospitals are currently facing a financial deficit. This is because of the fact that healthcare may be too affordable for citizens, therefore making it too expensive for the healthcare providers. Also, Japan is currently facing a shortage of healthcare providers, including physicians. This is due to the low pay for doctors and the high stress and long hours that are required of them. Also, there is less incentive to drive innovation. This can also be attributed to the low pay. Lastly, the older population is increasing and therefore driving up healthcare costs for all the other citizens due to the longer life expectancies that have been noticed on trend over the past few years.